Hi, I'm Dr. Trent McKay. I'm a board-certified orthopedic surgeon at Olympia Orthopedics in Olympia, Washington. Primarily specialize in shoulder disorders and shoulder surgery. I get a lot of questions about how to deal with shoulder problems and shoulder pain after surgery, so I wanted to take a few minutes to talk about some of the issues that are involved in dealing with pain after surgery. By far, the biggest question that I get is, does it hurt to have shoulder surgery? And the answer to that, unfortunately, is yes, it does hurt. As an orthopedic shoulder surgeon, I know it's probably one of the worst pains after surgery that a lot of people will have to experience. But frankly, it's not the same for everybody. There's a very wide variation. Some people that I operate on really have very little pain, and some people really have much more pain. So it's a very individualized experience. What I was hoping to do with this video is to give you a few tips to try and get through rotator cuff surgery and shoulder surgery just in general. So the first thing I want to talk about was pain medications and some of the medications that we more commonly use to help people through shoulder pain after shoulder surgery. The number one medication that we're going to use is an opioid narcotic. I think it's a little beyond this discussion to talk a lot about how exactly you should do that. I think that's individualized with the patient and the doctor for different practices, but at some point that will be used. Instead, I really wanted to talk a little bit more about managing the side effects of using an opioid narcotic. By far the biggest complaint that I have for people who are using a narcotic pain medication after surgery is that they get constipated. I have a couple of different ways that I help people with that. Number one is to use a pill that's called a stool softener. I typically use Colace, and that's a prescription that I will typically write for a patient, but it's actually available over the counter, so you can pick it up that way. And then the second thing is I use a medication called polyethylene glycol. This is available over the counter. This is one that I picked up at Costco called Laxaclear. The more common name is Miralax, and it's pretty easy to use. All you do is you take the powder and you fill the powder into the cap until it's full. You take the cap and dump that into a half a glass of water and stir it till it's completely clear, so it's completely dissolved, and you drink that. You can take that once or twice a day, and usually that, in addition to the Colace, will solve most of those problems. In fact, sometimes I tell people that they should start before the surgery so that they don't develop that problem afterwards, because once you get constipated, it's pretty hard to get through that. Another common question that I get is, how long does this hurt? And that's a really hard question to answer. Reality is some people don't have very much pain. Some people will hurt for 18 months. So it's extremely variable. I would say one of the risks for people having long-term pain is actually a couple things that we've identified. Number one is that if you go into surgery and you are already using pain medications, your body is going to be sensitized to those pain medications, and what we find is they don't actually work all that well afterwards. So you need to try and do anything you can to get off all pain medications while you go into surgery. Probably one of the most common questions I'm asked about pain medications is when should I start my pain medications? And the answer to that is a little bit different for everybody. So let me just play out a couple of scenarios for you. In some surgeries, you're going to have something called a nerve block. A nerve block is a numbing medication that goes into the nerves kind of by the neck. And what it does is it makes the whole arm go numb for a variable amount of time. Sometimes that block will work for 12 hours, sometimes it will work for 3 days. I think the average that we tell people is about 18 hours. So when you come out of surgery, you won't really be having any pain. However, when you go to sleep and the block wears off, a lot of time that pain will come on, and it comes on very strong. The graph that I try to have people visualize is that if you imagine that you had a surgery and this is your pain level over here, most people are going to wake up from surgery and their pain level is going to be in this area, and then it's going to tail off slowly. When you have a block, instead when you wake up there's no pain, but when the block wears off, there's a pain spike that goes way up here for a little bit and then comes back down to the line. Okay, that little spike catches people by surprise. And if you don't have any pain medication on board when you hit that spike, a lot of times you'll find yourself a little bit behind, and it really does increase the pain. But typically what I'll tell people is when they go to sleep the night after surgery, even if they're not having a lot of pain, you ought to go ahead and start taking the pain medication so you don't get